You may have noticed some changes in your body and started to wonder, could I be pregnant? Alternatively, you may not have observed any signs of pregnancy other than your period being late. If you suspect you might be pregnant, you'll probably want to take a home pregnancy test. If the result is positive, congratulations. Watch the video until the end to learn more about early pregnancy symptoms, how your baby develops when you're 1 month pregnant, and what else is in store for you this month. Common pregnancy symptoms at 1 month pregnant. At 1 month pregnant, you may not experience many or any symptoms. However, some of the early signs of pregnancy at 1 month pregnant can include 1. Missed period. If you have a regular menstrual cycle, a late or missed period is a common sign of pregnancy. 2. Mood changes. Pregnancy can cause hormonal changes that may lead to emotional ups and downs. It's important to talk about your feelings with your loved ones and healthcare provider. 3. Bloating. Pregnancy hormones can cause bloating, similar to PMS symptoms. Eating more fiber and getting regular exercise can help relieve bloating. 4. Cramps. Some women experience mild uterine cramping in early pregnancy, which can feel like menstrual cramps. If the cramps are painful, consult your healthcare provider for suitable pain relief options. 5. Spotting. Light spotting, known as implantation bleeding, may occur when fertilized egg implants in the uterine lining during early pregnancy. Wearing a panty liner can help prevent any leaks or stains. 6. Frequent urination. Increased blood volume during pregnancy leads to extra fluid processed by the kidneys, resulting in frequent urination. Stay hydrated but plan for restroom breaks when needed. 7. Sore breasts. Breast tenderness is common in early pregnancy, but may lessen as your body adjusts to hormonal changes. 8. Fatigue. Feeling more tired than usual is common, possibly due to hormonal changes. Rest and take it easy when needed. 9. Nausea. Morning sickness, including nausea and vomiting, typically starts after the first month of pregnancy. Stay hydrated and consider ginger tea to soothe your stomach. 10. Constipation. Hormonal changes during pregnancy can slow down the digestive system, leading to constipation. Prenatal vitamins containing iron may also contribute. Ask your healthcare provider for advice. 11. Food aversions. Some pregnant women may experience aversions to certain odors and flavors, often linked to morning sickness. Use a kitchen fan when cooking and avoid strong smells that bother you. How is your baby developing this month? After fertilization, the egg travels through the fallopian tube to the uterus, where it implants in the uterine lining. The egg divides into cells, with some forming the embryo and others becoming the placenta, which will nourish the baby during pregnancy. The umbilical cord also develops, providing nutrients and removing waste. In the upcoming month, there is rapid growth as the baby's internal organs, bones, and limbs start to form. In medical terms, the little one may be referred to as an embryo during the first 8 weeks, and then as a fetus until birth. How big is your baby when you're 1 month pregnant? By the start of the second month of pregnancy, your baby will be about 1/4 of an inch long, which is the size of a pumpkin seed. What does an embryo look like at 1 month? For a peek at what your baby might look like inside your belly at 4 weeks, check out this illustration. Changes to your body at 1 month pregnant. You may not notice any changes to your body yet, but a lot is happening underneath the surface. It's important to prepare your body for pregnancy and childbirth by focusing on your overall health and nutrition. This may involve taking a multivitamin supplement to ensure you and your baby have all the necessary nutrients for the months ahead. Talk to your healthcare provider during your first prenatal visit to ensure you're getting the right amounts of the right vitamins. Starting or continuing an exercise routine can also be beneficial this month. Consult your provider to confirm if your favorite activities are safe during pregnancy. In general, regular exercise can help build the strength and endurance you'll need throughout your pregnancy. How far along are you at 1 month pregnant? When you are 1 month pregnant, you are at the start of the first trimester, which includes week 1 through week 4 of pregnancy. There is no standard way of grouping pregnancy weeks into months, as they do not fit evenly. The breakdown of weeks into trimesters can also vary. A common method is as follows. First trimester, 1 to 13 weeks. Second trimester, 14 to 27 weeks. Third trimester, 28 to 40 weeks, or until you give birth. How is your due date calculated? Your due date is calculated as 40 weeks, or 280 days, from the first day of your last menstrual period. However, keep in mind that this date is just an estimate, as only a small percentage of babies are born exactly on their due date. Some frequently asked questions. How soon can you take a home pregnancy test? Home pregnancy tests are designed to detect the pregnancy hormone HCG in your urine. Typically, they claim to work from the day after the first day of your missed period, but some brands may be more sensitive than others. Will you have a belly at 1 month pregnant? At this stage, you may experience some bloating, but you probably won't be showing a baby belly. Is it safe to exercise during the first month of pregnancy? You can continue with your existing exercise habits if your healthcare provider gives you the all clear, or you might like to take up more gentle forms of exercise like swimming, walking, or prenatal yoga. How big is an embryo when you're 1 month pregnant? At 1 month pregnant, the embryo is very small, but by the time you're 5 weeks pregnant, the baby looks like a tiny curled tube that's about 1/4 of an inch long. Checklist for when you're 1 month pregnant. Research and select a prenatal healthcare provider. Confirm your pregnancy by taking a home pregnancy test. Arrange a doctor's checkup to confirm your pregnancy and get guidance on the coming months. Speak to your provider about pregnancy nutrition and any prenatal vitamins you may need. Download a complete guide to exercising while pregnant and ask your healthcare provider for recommendations. Quit unhealthy habits like smoking and drinking and try to reduce stress. Rest whenever you can. If your partner doesn't know you are pregnant yet, consider fun ideas for how to announce your pregnancy to them. Speak to your loved ones about how you are feeling, as it can be an emotional time. Thank you for watching the video. Please remember to subscribe for more content.